Hi, my name is Dr. Daniel Bearzins, and I'm a naturopathic medical doctor at Protea Medical Center in Chandler, Arizona. Here at Protea, and one of the things that we focus on is endocrinology is kind of at the core of what we do here. And one of the ways that I found naturopathic medicine, or that kind of called me to Protea Medical Center, was searching for something different within medicine and how our traditional model was continuing to fail patients, and not only patients, but both myself and personal family members, my wife included. My wife, she had an undiagnosed thyroid condition that she battled for, almost 10 years. And it seemed like something that was never ending, something we were never going to get answers for. And my mom had actually found a naturopathic physician's office across the street, had asked us to go and check it out. And I was absolutely amazed at what I found with what naturopathic medicine had to offer. And really what we truly believe here at Protea Medical Center is getting down to the root cause of patients' issues. And often simple things like fatigue or insomnia, headaches, heavy menstrual cycles, some of these things are often just very overlooked in our traditional model. And some of that isn't the fault of the physicians, but sometimes the system that they're in. When you can only spend 7 to 10 minutes in a room with a patient, there's very little information that you can gather to be able to appropriately put together a treatment plan or offer adequate solutions to a patient. And my wife, when we first sat down in a naturopathic medical doctor's office, we spent about 45 to 60 minutes with the doctor. And that's one thing that we really pride ourselves in here at Protea, is spending quality time with our patients. Our first visit is actually kind of a little bit like an interview, where we're just taking the time to get to know a little bit more about you. You're a person. You come with a whole list of, whether they be traumas or other previous medical diagnoses, things that have happened to you that contribute to your health and who you are today. And all those things are important and play a role in your symptomology. And 60 minutes of my wife answering, many questions that had never been asked before by this physician. She was able to get some answers and feel like a completely different person in a matter of about 6 weeks. And these were through simple things that we really focus on here at Protea, which is getting down to lifestyle like diet, exercise, sleep. And our big focus here is looking at the hormonal component. One thing I like to describe with patients is kind of like this pyramid of our hormones and how they all kind of interact and contribute to a lot of the symptoms we feel. And at the top of that pyramid, we talk about the thyroid. The thyroid being really involved, and most people know it as something for our metabolism. If it's a slower thyroid, we can have hypothyroidism and be more predisposed to things like weight gain. Or you can have the opposite, which is actually what my wife had, hyperthyroidism, where thyroid is really overactive. We're sweaty, heart racing, having to go to the bathroom frequently. A really delicate relationship with the thyroid is actually something called the adrenal glands. These two little glands that sitting on top of the kidneys. And these are like our fight or flight response comes from the adrenal glands. Things like cortisol, norepinephrine, adrenaline. Adrenal glands play a really intricate and balanced role with the thyroid in keeping one another in check. So there's the thyroid, we've got the adrenal glands. And then another way I like to describe the third aspect of that pyramid is like our sex hormones. So in men and women, we're looking at things like testosterone, estrogen, progesterone, and even some of our downstream metabolites like dihydrotestosterone. Dihydrotestosterone by itself is actually quite a bit stronger than testosterone in its affinity for binding to our androgen receptors in our body. And men will often come to us and they'll have maybe low normal testosterone levels, but dihydrotestosterone's never been checked on them. Men with normal testosterone levels but deficiency in dihydrotestosterone will feel much more of an androgen deficiency with just having the deficiency there in DHT. The other aspect is our environment has played a huge role in ways that our body metabolizes things like estrogen, certainly like a downstream metabolite like estrone, another thing that we'll kind of look at. So of that pyramid, one thing that we have kind of in the middle of that pyramid is something called insulin. And insulin is a really interesting hormone that we talk about here at Protea, because insulin is kind of like the thermostat. I describe it to patients where insulin, especially in a fasted state where insulin is high outside of meal times when we want to have good insulin, insulin really drives our body to want to store body fat versus wanting to pull from that fat for energy. And patients will come in and they'll have maybe normal fasting glucose levels or a normal hemoglobin A1C. By no means are they diabetic, and some are, but even a pre-diabetic range. But we take a look at a fasting insulin level, and that's a huge indicator for why patients may be struggling to lose weight, or patients are able to lose a little bit of weight and unable to maintain that weight loss, with insulin being a huge driver for them wanting to store body fat. Physician-assisted weight loss is a huge thing that we focus on here at Protea, and it's a really vulnerable aspect that patients bring to us and entrust in their care. One of the things that we really pride ourselves in with helping patients in things like physician-assisted weight loss is doing it right by those patients. We use something called a InBody here at Protea, and you might be familiar. This is something they have at many gyms and that people can actually have access to in their homes, where we're looking at not only just the number on the scale, which for so many people can be very triggering or bothersome, but we're looking at a body composition overall. Things like percent body fat, skeletal muscle mass, dry lean mass, total body fat mass. So when we're dealing with weight loss, we're not just looking at a number, but we're looking at a person's composition overall. And really our big focus is, if we're helping patients in losing weight, can we do it in a manner that not only helps them reduce body fat mass, but maintaining their skeletal muscle mass, if not building their skeletal muscle mass. It's a huge component to weight loss, not only for helping lose weight, shifting percent body fat, but this is for patients to be able to maintain their weight loss. We know that the more lean muscle a patient carries on their body, the increase they're going to have in things like their basal metabolic rate. Their basal metabolic rate is the thing that's giving them the afterburn all day long. That's the sustenance for keeping the metabolism going. For ladies, we often work with our menopausal or perimenopausal ladies who are battling deep drops in things like estrogen, which helps maintain their bone mineral density. Things like resistance training and having normalized testosterone or androgen levels are really key hormone foundations for maintaining bone mineral density, lean muscle mass, and saving them from things like hip fractures occurring from osteopenia or osteoporosis. 1 in 3 patients who suffer a hip fracture after the age 65 will pass away within a year due to different morbidities that are associated with hospitalizations and those things. So much of what we do here at Protea is it's lifestyle medicine, and I kind of mentioned, things like hip fractures and the rate of mortality after those hip fractures. Hormones play such a huge role, especially in our bone mineral density and the ability to set ourselves up for long-term health. One of the 6 principles of naturopathic medicine is docere, which is doctor as teacher. Education is just a huge part of what we do here in all of our patient visits, and not only telling patients this lab, something like estrogen looking low, and our concerns for increased bone turnover or for things like osteoporosis, but also patients knowing why it's important to treat these things early. I always tell patients preventative medicine is the best medicine. So if we can prevent a condition from ever happening before osteopenia happens, osteoporosis, and then subsequent hip fractures, we are really in the preventative medicine space. Hormones play such a huge role in our brain chemistry too. We see, things like anxiety, depression, anxiety attacks. Those things become much more apparent with changes in our hormones. And we're seeing these things at younger and younger ages, men and women. And really at Protea, it's about getting down to tangible things like lab values, not just having a hypothesis on what might be going on with the patient, but let's discover what's going on here. Let's find something tangible with lab values. They correlate often with how patients may be feeling, and sometimes they don't. They're not a perfect thing. At the end of the day, we have to look at the patient that's sitting here in front of us and how we can best support those patients. But when starting things like hormone replacement therapy, not only is it appropriate to have lab values before starting, but checking in on those patients and doing proper timing for lab values. Here at Protea, we really pride ourselves in closely monitoring patients and making sure that labs stay within a safe range, and also looking for canaries in the coal mine, things that might suggest or decreased bone mineral density or increased bone turnover, things like alkaline phosphatase in a lab or low estradiol levels. These are all things that we look at here at Protea. I mentioned docere. Docere is one of the 6 principles of naturopathic medicine, and it stands for doctor as teacher. Every patient should walk away from each visit here at Protea Medical Center feeling empowered. They have a better understanding of their health, what their symptoms might mean, and how they might be correlated to things that they're experiencing in their everyday lives. Our goal is to really empower patients to take their health into their own hands. If you're someone who feels like you haven't had enough time with your physician, you haven't felt like you've been heard, or you feel like you haven't been validated for some of the things that you've been told. Your physician maybe has told you, well, you just need to eat less and exercise more, or it sounds like it's more something psychological. If this is you and you just feel like you need someone to listen, because there's so much therapy that's even just offered and holding a safe space for someone, then I would definitely encourage you to come and establish here at Protea Medical Center and get a taste for yourself. What you can expect from an initial visit here at Protea is it's about 60 minutes for our initial visit, where we take the time, we're going to get to know a little bit more about you, and then from there we're going to put a plan in place for what labs might be appropriate to better understand your type of condition. After that, follow-ups are like lab reviews, where we literally almost chop it up line by line. Patients go home with a copy of their labs. They don't just get a phone call saying, well, everything looks normal, when you're certainly not feeling normal. So patients go home, they should have a copy of their lab work, and they're going home with a bit of hope that everything that they've been feeling and experiencing, well, there's something actually to that. And this is shared decision-making, not a dictatorship. And so our job as physicians is to meet patients where they're at and to find something that's going to work within their current lifestyle. It is probably going to require a little bit of change, but that's where we come in to really help push and encourage our patients. This is kind of like a partnership, and we're in this together. We're willing to get down into the weeds and go to battle for you here. If you want to find out a little bit more about what we do here at Protea, please take the time, check out our website. Feel free to give our office a call. We'd love to see you. You can call or text to get scheduled here, and we're really looking forward to seeing what we can do to help you live your best life.